This is our fourth installment of the Phenotype Speaker Series, and today we are talking about genetic counselors in leadership roles, and I am surrounded by leaders in genetic counseling where we're going to dive into these topics today. So thank you so much for joining us for this fourth installment of the Phenotype Speaker Series. The outline for today's webinar, we're going to spend about 40 minutes during our panel discussion where we're going to be talking about lots of topics within this leadership roles in genetic counseling. Then we're going to do 15 minutes of Q&A. And so today's webinar topic, I mentioned it's going to be leadership. We're going to be discussing how genetic counselors offer unique perspectives and skills that naturally transition to leadership roles. But we found that genetic counselors often aren't in these roles. So we're gonna address this disparity and talk about how we can change that. So to do this, we are hearing from personal leadership experiences from our lovely panel here and hearing their insights on these topics. So it'd be great to have each of you introduce yourself to the audience so they can put your face and name together.
Hi, I'm Vishaka Tripathi. I'm a consultant genetic counsellor at Guy's and St Thomas's, working predominantly in cancer genetics. And I'm based in London, UK.
My name is Livia Medna. I am a genetic counselor and a co-director of the Roberts Individualized Medical Genetics Center at the Children's Hospital of Philadelphia in the US.
And my name is Jessie Conta. I'm a genetic counselor in the laboratory at Seattle Children's Hospital. I manage our laboratory genetic counselor team, and I'm the director of genetic counseling services for PLUGS, which is a lab utilization guidance service.
So we have lots of leaders on this call today from all over the globe. So it's really exciting to have you three on for this discussion. Just want to remind the viewers that if you have questions during this conversation, we're going to be answering them in the last 15 minutes of this webinar. So about 12:45 for people that are on the East Coast. And so feel free to put your questions into that Q&A chat. If you see a question that you want answered, upvote it. And we're going to get to that in the last 15 minutes. So thank you again for everybody that's coming on and watching us and for our lovely panel here. I'd like to start out with a little perspective of how you each pursued and obtained your first leadership role in genetic counseling. Vishaka, would you like to start?
Sure. So I think I was really well supported by my manager when I managed to secure my first leadership role, which was really important because my manager was able to have some really honest conversations with me about relevant opportunities, but also, you know, strengths that I had and some gaps that I had that I needed to develop further. I also invested in a mentor at that time, which was probably the best thing I did. So this was someone more senior within the profession who was in a leadership position already outside my line management, which I think is really important because that, you know, the mentoring role is a more nurturing role in contrast to your line manager who you might be going to and asking for a promotion. To put in a lot of hard work, lots of extra hours. It's certainly not just magically going to happen in 9 to 5, and I think that's the reality of it, regardless of where you work. And to keep your expectations, my expectations, realistic, that you try and hopefully it may happen and it may never happen at where you are at that moment, but certainly it will develop you, and at the right time it will happen.
Very well said.
I guess I'll go next. I think I want to emphasize that leadership in genetic counseling or in any profession has several tracks. And I think when people think about leadership, many people think about having direct reports, supervising a team, being kind of in the classic pyramid scale of leadership where someone is at the top, or if you look at the bigger institution, in the middle of that hierarchy of leadership. I certainly did not get started that way. And I started by being a leader of content and being a leader of process. And I think that is an equally satisfying or appropriate way to see your career rise and see your career advance. When I was given more responsibilities, that was within patient management and clinical care aspects, I kind of gained my a reputation or maybe invested a lot in during the process when first clinical trials came on board for neuromuscular disorders. I had the privilege to be on great teams at CHOP who did those and was